Hello, and welcome to our webinar, Shape Your Future 2020, Life as a Healthcare Professional. My name is Tamesia Alston. I'm the founder and CEO of both Alston Management Group and AMG Health Institute. So just to get started, I wanted to go over our agenda. I'll first talk about myself, my history in healthcare, and then go on to speak about the fields of billing and coding, or the differences in between the two. I receive a lot of questions about our billing and coding program, which are two separately identifiable programs, but a lot of people hear billing and coding go hand in hand, and so they assume or they think that it's one program. So I just wanted to talk about the differences and what's included in each role. I'll then go on to talk about career options and outlook, as well as getting started in the field. So who am I? Again, my name is Tamesia Alston. I've been a healthcare administrator for 18 years, supporting all aspects of the revenue cycle to include billing, coding, compliance, auditing, management, and even education. I've worked on both the medical and dental sides of healthcare, covering nearly every specialty, and that includes medical specialties and dental specialties. I earned my bachelor's degree in accounting and master's degree in business administration. I have the following credentials. I'm a certified professional coder, I'm a certified instructor, I'm a certified dental coder, and I'm a certified medical insurance specialist. And as I said in the beginning, I'm the owner of both AMG, or Alston Management Group, and AMG Health Institute. As far as Alston Management Group is concerned, we are a full-service practice management group, meaning that we provide the billing, the coding, compliance, auditing, and practice management services to small practices, in addition to team trainings and education as well. As AMG Health Institute, we provide medical billing, medical coding, dental billing, and dental coding education to individuals, to high schools, as well as to organizations who are interested in professional development for their teams. So whenever I talk about my journey, I cannot move forward without first talking about my why. I think understanding your why, acknowledging your why, and sharing your why helps you to remain grounded. It gives you a foundation, and it's always something to look back on whenever you're having a rough time or you just need a reminder of why it is that you do what you do. This picture on the screen is of my daughter. She's almost 13 years old. Whenever I started in healthcare, I was about 18 years old, and I had the opportunity to work in a dental practice. There was a dentist who came in. I was working at CVS at the time, my freshman year of university, and he complimented my customer service and asked if I had an interest in working in his dental practice. Whenever I first started the university, or my education, my postgraduate education, I wanted to be a dentist. And so it was such a great opportunity at the time for me to start in the field. I actually started as a dental assistant and worked my way into the front office, where I learned office administration, registration, billing, dental coding, and so forth. What I love back then and still love today, 18 years later, about the field of healthcare are the following things. The flexibility. Whenever I had my daughter, I was only 22 years old. And so I knew that because I was a military spouse, that I needed a career that provided flexibility for me to be mom and for me to have a successful career. Work is very important to me, but nothing's more important than taking great care of my child. And so healthcare has allowed me, since she's been born, to be able to have that work-life balance, which is my third bullet point, promoting work-life balance. So I've been able to work from home whenever I've needed to. I've been able to stop my day and go and pick up my daughter whenever she's sick. And so those are the things that I appreciate as it relates to healthcare. The field is also very rewarding. Every day that I wake up, I am happy going into work, whether I'm working from home or I'm actually going into an office. I feel a sense of accomplishment every day. I'm able to help others, whether I'm on the front end helping patients or helping providers or helping my team, or even on the back end, even working with vendors. No matter who I come in contact with, I find it very rewarding being able to help others, being able to educate others, being able to have impact and empower. Those are the things that are very important to me. And my career in healthcare has allowed me to do what I'm most passionate about. In addition, healthcare comes with great benefits, but I always tell people not to focus solely on salary. Of course, you want to have, a good income. You want to be able to take care of your family, but you also need to look at the other benefits that the company provides. So going into an organization, I always have a list of questions that I ask. And a lot of it deals with my certification and my professional development. Because I have certifications from different agencies, I first ask, do you have any benefits to support my professional development? Do you pay for me to maintain my certification, since it's a requirement of my position? Do you provide continuing education or opportunities for continuing education units through the organization? As in, do you have a membership with AAPC that allows me to have access to their free webinars through your subscription? Does the organization, pay for the entire billing and coding or revenue integrity or revenue cycle department to maintain their certifications? What does the organization do to promote professional development? Does the organization bring in consultants? Do we have classes throughout the year? What does that look like? As far as tuition reimbursement, does the organization pay for me to obtain degrees, whether it's an associate's degree, a bachelor's degree, a master's degree, and what are those requirements? How long will I have to work in order to tap into those benefits? In addition, if I'm interested in another certification, will the organization allow me to use my tuition reimbursement benefits toward certifications and not just degrees? And then, of course, the field of healthcare has competitive compensation. Like I said, it's very important to have a good salary. You want to be able to take care of those things that are very important to you in your life. You want to be able to live, not just, go to a job and work and not have any money left over to enjoy. You want to be able to thrive. And so when it comes to healthcare administration, especially when you have certifications, it allows you to make more money. And so when it comes to the competitive compensation, whenever you're going in for an interview, you have to sell yourself. You have to make sure that you're not just accepting whatever they offer you. You're going to try to negotiate. Go into it after researching what the market suggests for your area and come up with an idea of what it is that you would like to make per hour, per year, based off of your expenses. You know, you want to look at your budget and see exactly what it is that you need to make in order to live happily and comfortably. But also, you want to look at that market analysis to make sure that what you're asking, it fits within that range. And so normally employers have a range, a salary range for each position. And you know, you want to, based off of your experience, have something that fits, you know, comfortably within that range for the employer and both yourself. So just getting started when it comes to revenue cycle, you know, billing, coding, that's all part of our healthcare revenue cycle. And here's a picture of a nice revenue cycle, medical, billing, and collection cycle. And it's the same on the dental side as well. So it's not limited to just the medical industry. So what is a revenue cycle? Essentially, it's the cycle used to track revenue of patients from initial appointment or encounter with the organization to the final payment of the balance. So the revenue cycle actually starts whenever we're scheduling that patient. So that first phone call, when we're getting all of the patient information and demographics. One thing I like to say is that if there's an error in any part of the revenue cycle, it will impact the rest of the cycle. For instance, if whenever we're taking that patient's information and we misspell their name, we enter the incorrect date of birth. It could be something as simple as the address, or choosing or selecting the wrong insurance, because there are so many different types of insurance. So let's say your patient has Blue Cross Blue Shield and you select the wrong group. So all of that, once the patient comes in, they have registered, you know, insurance verification, we enter charges and we send it off to insurance. If we have inconsistencies or inaccuracies in our data entry, that will end up having an impact on the claim submission or billing. So the claim can be rejected if there are errors in our data entry, or if we have errors in our coding, there could be denials. So all aspects of the revenue cycle, all positions that are included in the revenue cycle are very important. So what is medical coding? I'm asked that a lot. Medical coding is the transformation of healthcare diagnosis, procedures, medical services, and equipment in universal numeric or alphanumeric codes. What does that mean in plain terms? Whenever you go to the doctor or you go to a surgeon, they have to document the care that you received. So they ask you questions. They, you know, ask you, what are your symptoms? What are your signs? They talk about the plan, your treatment plan, and whatever procedure they perform, they have to document all of that. Any history that you have, all of that's documented. And so as a coder, what we do is take all of that information and we translate it into codes, whether it's numeric or alphanumeric codes. And those codes, in fact, are what triggers a charge. So you're not charged for a service until medical coders or providers actually code the case. So medical coding professionals help ensure the codes are applied correctly during the medical billing process, which includes abstracting the information from documentation, assigning the appropriate codes, and creating a claim to be paid by insurance carriers. So medical coding comes before the medical billing function begins. Medical billing. It's the process of submitting and following up on claims with health insurance companies in order to receive payment for services rendered by a healthcare provider. As I stated previously, medical billing comes after medical coding in the revenue cycle. Medical billing has so many different functions. You may work on the front end, you may work on the back end, you may help with fighting denials on the AR side. You can have contact with patients, sending out statements, collections. There are so many different things that you can do in the field of medical billing. There are also analysts, so you can be looking, in detail at what's being paid. So much is involved, but essentially medical billing is the process of submitting and following up on those claims. And normally you are working with the claim until it's paid in full by the insurance company or the patient. Career options. The one thing I love about the field of healthcare administration is that you're not limited. You're not, put into a box and told that you could only do one thing. You're actually able to learn, to grow, and to advance quite easily in healthcare. So what I like to tell my students when it comes to a certification in medical billing or a certification in medical coding is that you do not have to work as a biller or coder ever, actually. You're able to have the certification as part of your toolkit, which means that you're using it to achieve another role or to seek another role that may require the certification, or you're able to work in those roles. So you can work as a medical biller, you can work as a medical coder, but auditors require you to have your CPC. So you could work as a quality auditor where you're checking documentation, you could be checking coding. There's so many different things that you can check as an auditor. But the foundation of auditing is understanding billing and coding. Compliance is the same. It goes hand in hand with auditing. You're looking at rules, you're looking at regulations, you're making sure that your organization is being compliant with federal and state guidelines or organizational guidelines, even departmental guidelines. So you're looking at so many different layers in compliance. And again, the foundation is understanding billing and coding to support whatever area of compliance that you're in. You're able to work as a revenue cycle analyst. Again, there's billing and coding sides to analysts. You're able to work as an instructor once you have at least 5 years of experience. I started in practice operations management. So kind of going back to my story, I started on the dental side. I started as a dental assistant, quickly learned the front desk, registration, insurance, coding for dentistry. And within 2 years, I was promoted to a practice manager where I managed a small dental practice. From there, that office actually closed as the provider relocated from Massachusetts to Florida. And so I joined another dental team. This office was a bit larger. And so in that office, again, I had more responsibility because it was a larger office, but I oversaw not only the front office, I oversaw dental assistants, hygienists, anyone that worked in the office. I managed that entire team. So when it comes to practice operations management, you're not just managing revenue cycle. You are actually responsible for the entire operations. And so whenever I talk to students about starting in the field, what I love about my personal experience is that I started from the bottom. And I don't like to call it the bottom, but a lot of people think that whenever you're in registration, it's starting at the bottom. Because I feel that every part of revenue cycle is equally as important, I don't consider it the bottom. I consider it part of my toolkit. And it was very essential in me learning registration and billing and coding in order to be a great manager. So practice operations includes all aspects of running the organization, the practice. It's knowing the business side, it's knowing the billing, the coding, everything, understanding what your nurses or your clinical team is working on, as well as knowing the revenue cycle. And the same with revenue cycle supervisor or manager. That position just supports revenue cycle. I've also had experience as a coding operations manager and a reimbursement manager. As a coding operations manager, I supported all surgical specialties at Duke Health System, which was a very rewarding experience for me because with surgery coding, it's all abstract coding. So you're looking at documentation and you are coding each case. So in primary care, a lot of times you will find that the providers are actually coding their own cases, but in surgery, you're coding cases for providers, which means that you have a really close-knit relationship with your department that you are providing the services or coding for. And so the department in which I worked, we worked hand in hand with the providers. We actually attended their provider meetings, their staff meetings. We did monthly newsletters for them. Anytime that there was an update in the coding from year to year, we went and educated our providers as well as their departments, because it's very important that they understand coding. We as coders are experts in the area of revenue cycle of coding. Providers, they attend school and they are experts in clinical care. And so we have to understand that providers need our expertise, but they need it in such a way that we honor, we actually respect their expertise and kind of help them to understand the guidelines, the laws surrounding coding. So it's a very important relationship. As reimbursement manager, I oversee reimbursement for this entire country right now for a medical electronics company. And as reimbursement manager, I have front-end billers, I have back-end AR team, and we're working with insurance companies for all 50 US states, whether it's Medicaid, because that is different per state, Medicare, TRICARE, we work with VA and all commercial plans. So knowing the insurance, actually having my start as a biller, has made me a better reimbursement manager. Charge description master, analysts, managers, supervisors, that is also another field. And as a charge description master, analyst, or manager, what you're actually doing is working with your hospital's charge description master. And in short, what that is, it's being able to build the codes in your practice management system. So whenever I worked as a charge description manager, I actually had to go for EPIC certification because my hospital was moving to the EPIC system. And so as a charge description manager or a charge description analyst, what they taught was being able to look at the code and know what departments would be able to use that code. So if you're in radiology, there are codes that you will never be able to use, so it shouldn't be on your list of codes to choose from. And so as a charge description master, analyst, or supervisor or manager, what the departments are actually doing is sending in requests to add codes, and you have to approve it based off of your knowledge of coding. And so that is a very good field to be in, especially if you like the IT side of healthcare. It's a very rewarding field because you're able to impact and educate the departments. And then, of course, an entrepreneur. You're able to have your own billing business, coding business, practice management business, or even your own school. So many opportunities in healthcare for entrepreneurs and more. So, getting started in the field. According to the U.S. Bureau of Labor Statistics, healthcare operations are projected to grow by 18%, or 2.4 million jobs from 2016 to 2026. And 8 of the top 20 fastest growing professions are in the healthcare sector. The Bureau of Labor Statistics reports that healthcare industry is expected to add more jobs than any other field from 2014 to 2024. And we can definitely see that now with the current pandemic. I have never seen so many positions open for healthcare professionals, even on the billing and coding side. I've seen a lot of remote positions during the pandemic. And so now is a great opportunity to actually show that you have the discipline to work from home. Of course, as a healthcare administrator, you have that flexibility. There are a lot of positions where you're able to work from home and some where you're needed in the office, especially if you are on the front end. But if you're working on the back end, there is a lot of work that you can do from home. Many times employers like for you to have at least 2 years experience, I say on average, before they allow you to work from home. But there are a lot of organizations that will say if you would work in office for about 6 months during a probationary period, after that time period is up, you're able to work from home. So when it comes to salary, a medical biller and or coder's earning potential varies. It depends on where you live, where you work, how much you work, education, certifications, and your experience. In a previous role that I had at a hospital, was actually in Spartanburg, South Carolina. What they did was they paid you per certification. It was about $40 extra on your paycheck per certification you have, up to about 3 or 4 certifications. So that has the potential of you making an extra, if it's $40, up to like $120 to $160 per pay period, which is substantial. And again, that's just for you having your certifications. Whenever you have a certification, it means that you're an expert in that area, and hospitals want to reward you for your expertise. So that's another question that you can ask during the interview, is whether or not they reward you, or what are the benefits that they offer for having a certification. Getting started in the field. One of my favorite things to talk about, because I absolutely love healthcare. It's been really good to me over these last 18 years. So when you're getting started, one of the most important things that I tell people, whether it's someone that I meet in passing, whether it's a student, whether it's a family member or a friend, is to find a mentor or a coach for help with planning. You want to map out your career path like a vision board. You don't ever want to look back and wonder what's next. After you've completed your certification, whether it's a certification in billing, coding, compliance, auditing, practice management, any certification that you have, you want to already know what your next steps are. You want to look ahead. You want to plan out your short-term and your long-term goals so that at any given point, you know where you're headed. Whenever you are working on a certification, you also want to start looking into internship, externship, and volunteer work to gain experience in the field, especially if you're new to healthcare. A lot of organizations require you to have some type of experience. And without that experience, you'll need to start in an entry-level role, which is my next point. Don't be afraid to accept an entry-level role. Most people look down on it, like I said before, but don't, because entry-level roles get your foot in the door. Let's say, for instance, you have your coding certification. You spent 20 weeks, you got your education, you took your CPC exam and passed it on the first try. Yay, 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 great job. So then you're looking at wanting a coding job, but the employers in your area are looking at coders to have at least 2 or 3 years experience. Well, just so you know, most schools, and this is something to ask, whenever you take a coding program or a billing program, the course itself counts as 1 year experience. AAPC also has Practicode, which gives you another year of experience. So that's the 2-year minimum. Whenever you accept an entry-level role, let's say you, instead of going into coding, you may go into billing or you may go into registration, and you're in a large hospital system. Well, normally, if you ask, they have some type of written policy that says you're able to transfer after a given period of time. And sometimes it's just a matter of 3 months or 6 months, which isn't a lot of time at all. So for 3 or 6 months, you're working in an entry-level role, you're gaining experience, you're understanding a different part of the revenue cycle that will only make you more marketable whenever your time is up and you're able to transfer into a coding role or a billing role or some type of advancement opportunity that may present itself at that point. But whenever you go into it, if you give your all, they will recognize that. And you could even get a promotion during that period of time that you're waiting to transfer. Always remember, once you're in the organization and you qualify for a position, they will interview you for it. So don't be afraid to accept an entry-level role. Have a professionally written resume that matches the job description. This is also very important. You want to make sure that your resume is professionally written, that it's very organized, and that HR departments are able to see the benefits that you would bring or what makes you very attractive to the organization. You want to also make sure that in reviewing your resume, most HR systems have a scanner, and so they scan resumes once you apply for a position and they check for keywords. So whenever you're working with a resume expert, you want to make sure that they understand that and that the keywords from the job description of which you're trying to apply is also evident in your own resume. Then you want to sell yourself when you're interviewing. So you have the nice resume, you have been given a call, and they want to bring you in for an interview. You have to sell yourself like you're selling a product. You want to make sure that you are talking about what sets you apart from other applicants. What are the skills that you have, the transferable skills outside of healthcare that you're bringing into healthcare? What is it that's that good about you? You always want to talk about what value you can add to the organization, because that's what they're looking for. That's what they want to know. What are they bringing in to the team if they hire you? And then benefits. I always talk about benefits because I don't want you to focus on salary alone. Like I said, I'm not going to go into that whole, conversation again, but just remember to ask those questions. You want to make sure that you're tying in your expertise and your certifications into that benefit package because you want to see if they'll take care of your annual dues for your certifications and making sure that there's professional development tied into it so that you can get your CEUs. And also remember tuition reimbursement. I mean, if you have your certification Or if you're just getting started in an organization, you may at some point want advanced degrees. You may want your associates, you may want your bachelor's, you may want your master's, or so forth. You want to make sure, even if you want another certification, that it's going to be covered. So ask those questions up front. The time that you have to ask questions to negotiate is before you actually get the job. So sell yourself. Negotiate, stand up for yourself, and make sure that you're getting what you feel you're worth. And then after you get the job, no matter what position it is, work like an entrepreneur, because when you're working for yourself, there's a certain mindset that you have, and you will always give yourself 1,000%. So no matter if you're working for a small practice, a large organization, or a health system, just make sure that the mindset that you have is that you're working for yourself. Give them 1,000%, and you will see the return on investment for shifting your mindset will be astronomical. You'll be able to advance in your career, and you'll wonder, like, where did that come from? I don't have my degree and they're already promoting me, but it's because of your work ethic. If you work hard, they will reward your efforts. And then seek advancement opportunities and research the time period before you're able to transfer, like I said before, if you're going into an entry-level role. You want to use tuition reimbursement to obtain other certifications. And then never forget your why. Always keep that at the forefront. It's the reason that you're doing what you're doing. Always remember your why. So AMG Health Institute. I founded the Institute in January after 18 months of planning. I have been in healthcare, like I said, 18 years, of which time I have worked at a college part-time as an instructor for healthcare administration, billing, and coding, and I absolutely love it. What I'm most passionate about is the marriage between healthcare administration, revenue cycle, and education. I like educating people about the field that has really made a difference in my life. I want people to know that you're able to be successful in healthcare with or without a degree. I made nearly $100,000 before I ever earned a degree. I was about 24. I was working in Boston at Tufts University School of Dental Medicine. I started as a supervisor, and within 6 months, I was promoted to manager of 5 different floors of front desk teams. Within another 6 months, I was promoted to a practice operations manager for their faculty practice, where all of the instructors worked. So all of the professors, they taught students during the day, but on their breaks, they actually had time to go in and practice themselves. And so I managed that entire operations from them. While there, I received my certified dental coding certification. I received my professional coding certification, as well as my associate's, bachelor's, and I started my master's degree while I was there. And so, fast forwarding, having my CPC certification has made me highly marketable, and for the last 8 years, I have not had to apply for a job. And so, again, healthcare has been very good to me. It's been good to my family, allowing me flexibility and a good work-life balance. And I want to be able to share that with everybody. I wanted to have a program that's licensed. So we're licensed by AAPC. That's who has certified me. And I wanted to also have a program of my own because I wanted to have something that's affordable. A lot of people feel that they're not able to obtain a certification because it's too expensive. And so I wanted an option whereby people would be able to afford it without going into student loan debt, because there are so many Americans that are tangled in student loan debt. And I didn't want that for my students. I wanted to teach students that they're able to get their certifications and they're able to use tuition reimbursement to further their education through their employers, where they would not ever have to worry about the student loan debt. And so here I am, uh, 5 months into owning AMG Health Institute, and I'm very thankful for the students that we have. We have a ton of students all across the US, in addition to students in India and students in Nigeria. And so, very fortunate to have the Institute and to share my love with all of the students and with others in the community. So, what sets us apart at AMG Health Institute? We provide both medical and dental billing and coding programs. So it's not just your medical billing or your medical coding. We also have dentistry as well. Again, that's where I started. I love dentistry. I understand the language of both medicine and dentistry, and so I teach both. Our programs are flexible. They're self-paced courses. We have online and virtual options, so you can take your course no matter what, completely online. We do have virtual sessions in the evening whereby you're able to connect with an instructor and have a classroom setting, so to speak, all from the comfort of your home. You finish in as little as 16 weeks for billing, about 20 weeks for coding, but you have access up to a year. So if you want to accelerate, your degree or your certification program, you're able to finish in that short amount of time, in a matter of months. But for those of you who would prefer going at your own pace, you have up to 1 year access into your course. We have expert CPC certified coaches, all of which who are still in the field. We have on average about 20 years of experience, and we have instructors that work on the clinical side as well as revenue cycle. And so when it comes to medical terminology, yes, we have nurses that we've partnered with that are able to help us with that terminology. We do have billers, we have coders, we have managers on our team as well. So certified instructors. And then all-inclusive tuition. A lot of times you go to school and you pay for tuition, and then you have to pay for books, and you have to pay for this and pay for that. Well, everything is included in our course. We have textbooks, manuals, AAPC membership, the cost of your certification exam, which comes with 2 attempts. Of course, you have the online platform. We use Blackboard. We have virtual sessions that are included in the fee. We have career coaching, so someone to look over your resume, someone to help you with interview preparation, and we'll also try to work with recruiters in your area to help you find a job. All of that's included in our course. In addition, everything's hands-on. You have a lot of hands-on practice. So after you have read a chapter, we have practical applications where you're able to actually apply what you've learned. We have a lot of different coding scenarios. We have practice coding exams, practice billing exams, so that you're able to know exactly what the actual certification exam is like. And then in the end, you have a certificate of completion counting as 1 year of experience. When it comes to our programs, right now we have a special that, our programs are $2,800 as your total investment, including virtual sessions. Guys, that's very inexpensive. It comes to about, depending on the plan that you choose. So you're able to pay all up front, but we do have other plans that you're able to access. You could give us a call for more information in regards to the different installment plans that we offer. But some of them come out to being as little as $7 to $8 per day, the cost of a meal. And so anyone who is viewing this webinar Anyone who has attended the webinar, we're actually offering $200 off just for you. All it takes in order to start our program is a non-refundable deposit of $350. Again, you're able to pay all up front, or we could add you to one of our installment plans. So in closing, here are my contact details. Again, my name is Tamesia Alston. I am the owner of AMG Health Institute and Alston Management Group. Our web address is www.amghealthinstitute.com. Our email is support@amghealthinstitute.com, and our phone number appears as 984-464-0887. And now to our Q&A session. The first step to receiving an answer is being brave enough to ask a question. Stop what you're doing and text 984-464-0887 to schedule your complimentary call with a member of our team. Any other questions, guys? Make sure you call, text, email, or send us a message on one of our social media platforms. We look forward to working with you. Have a great day.